Thanks very much for the invitation to speak today at this event. And as ever, whenever I prepare a talk such as this, I always think it's a shame that I hadn't heard the morning session before I did my preparation, because so much that was said this morning, the rich conversations and discussions that I sat in on, really helped me understand more about Public Health Scotland. I'm not Public Health Scotland, I don't have a background in that. I have been working on all sorts of aspects of local government reform. I was a member of the Christie Commission, and as I'll show in a moment, my background in this goes even further back. What I want to focus on this afternoon is really the question of collaboration. And I guess the big theme, the one negative theme to take away from what I want to say is, it's very difficult. It's not easy. It's extremely difficult. And we haven't got it yet right. And I think we will struggle, frankly, as we move forward with this public health agenda. But we need to do so. We need to do so if we are to take seriously the efforts and the rhetoric around improving well-being, improving outcomes, and so on. And I have to say, I spent a lot of my time travelling around Scotland, and one of the things I'm struck by is there is no lack of an appetite to engage meaningfully in our communities, in our public services. We are incredibly fortunate, I think, in having a workforce and a community, because we should never forget the third sector, that are deeply committed, and have always been deeply committed, to the achievement of some of the goals that have been set out in public health priorities that Public Health Scotland has outlined. But that does raise a simple question. If there has been so much commitment, why have we not achieved as much as perhaps we should? Now, the first thing I would say in answer to that is it's very clear it is not because of a lack of commitment at the local level. It is not the fault of individuals, it is not the fault of officials, it's certainly not the fault of our communities. There is something, I think, fundamentally wrong in the way in which our government structures operate and in which we have gone about making policy and delivering policy. And it pains me to say this, but 8 years on from the Christie Commission, of which I was a member, I don't think we've made as much progress as certainly the Commission had hoped and anticipated. In fairness, much has changed over that last 8 years. It's become more difficult because the context has become much more difficult. The public finances have been, frankly, much less healthy than we could ever have expected. And we've got other massive challenges ahead. Goodness knows what Brexit's impact will actually be, other than we know it's going to be very challenging and very negative. So what we actually set out 8 years ago rather, was an agenda for change, but we didn't take account of the changing environment. We couldn't take account of the changing environment. So what we've been trying to do, what you've been trying to do, is really go uphill, push uphill this agenda. And I think that's well worth noting. I said a moment ago that I've been working in this area for a long time. In fact, just reflecting on this, I was preparing this, I was just thinking back to one of the first pieces of work I was involved in some time back in the mid-80s. I was involved in the final evaluation of the Glasgow East Area Renewal Project. Gear will be familiar to at least to some in the room, some of the older folk in the room, and to others who may have studied it subsequently. GEAR was put forward as the largest regeneration programme in Europe at its time, starting in the 70s, going right way through the 80s, and it was an attempt to collaborate across public services. I think one of the key things that we found in the final evaluation, which I was involved with, was that we were still learning how to collaborate. And we didn't really make a great job of it. And I think partly we did this because we found this because there was really a very, very limited public involvement. There was just not much in the way of public engagement. And I think one of the big lessons from back then, and we are still learning this, is that if we want to move forward, we really need to use that expertise that lies in our communities. The users, as some would call it, are actually experts. And I think one lesson is that we need to do that. The other thing is that bringing people together, institutions together, is not enough. Bringing people together around the table, all the chiefs, the chief executive, chief constables, and all the rest of it, is not enough. It needs to reach right down into our communities. And I think that's one of the biggest challenges that we are facing today. It is not easy to do. I want to stress that. It is not easy to do. Now, since then, there have been numerous examples, and I've studied and written about this all years and years on from here in the mid-80s. And I guess the one that I think is most notable and interesting have been the community planning partnerships. And they have evolved, let's say. Evolved over their lifetime, and I have to say, looking at community planning partnerships across Scotland, they vary significantly, and they should vary significantly, because no two parts of Scotland are the same, and so therefore no two partnerships should be the same. I have to say that I have in the past been kind of a bit rude about community planning partnerships, and in fact some would say very rude, and I've often referred to a piece of work which was done on gear, which colleagues of mine way back in 1982 wrote about gear, that it was really a shift from quangos to mangos, by which they meant mutually non-effective groups of organisations. I honestly took the view, and I wrote this in a piece some years back, that community planning partnerships were a bit similar. And that in many cases, not all cases, but in many cases, they reminded me of Voltaire's comment on the Holy Roman Empire. There was nothing holy about it, Roman, and it wasn't an empire. There was just a lack of community planning and partnership. Now that has changed, because I think CPPs have been, importantly, learning institutions. They've learned and they've developed over time, but there's still a long way to go. And I think one of the ways they've had to go on that, and again, I would stress this is happening in some parts of Scotland more than others, is that they are reaching down. They're recognising that actually leadership, as it were, is not just held with chiefs. They have a very important role to play, but all of us have a role to play in our communities, and no matter what level, as it were, level even itself is an unfortunate term that we work within. So I think we're moving in this direction, the right direction, and it will be very interesting to see how Public Health Scotland moves forward. I think there's a great deal of reason for being optimistic. I tend to be pessimistic and pretty negative by disposition, but actually I'm very hopeful with respect to Public Health Scotland, not least because I think that we have learned so much, and there is such an energy and experience out there. I was absolutely delighted to discover that Angela Leach had been appointed the Chief Executive. I've worked with Angela over a number of years. I'm slightly disappointed because I live in East Lothian and we're going to lose a really good Chief Executive, but I'm delighted for Public Health Scotland. I think that's a really important appointment. And linked to that is that Angela and others have been so much involved in the local governance review that John mentioned this morning, John Wood mentioned this morning. And I'm delighted to say that the links within COSLA between Public Health Scotland and the local governance review have been very strong. And there's been a lot of interaction. And I think as we move forward, it would be really useful to ensure that those links are strengthened, and that we make sure that whatever happens in terms, I'm looking at civil servants as I say this, as we move forward in terms of local governance review, that we actually bring on board and ensure that we have that integration of thinking. So, I think that question that I've already alluded to, why is it so hard? There are numerous reasons why I think collaboration is extremely hard. And I'm going to touch on just some of them. Many of these points have been made earlier today, and I don't think anything I'm going to say is at all original. And one of the key things is that what we are dealing with are wicked problems. I'm going to come back to that. These are difficult issues when it comes to public health. I want to suggest that dealing with some of the health issues of the past have been easy, but I think we still have those major wicked problems which require the involvement of a range of institutions. These are the really tricky ones, and I do, as I say, I'll come back to them. I think there is a degree of risk aversion in our politics and in the way in which we operate. And I don't blame public servants for thinking, I'm not one to take a risk. I don't want to take a risk. I want to go home and, be able to sleep at night and not have to worry. We should not expect our public servants to have to worry about something they've done. So there's something in our system that is not allowing for, if you like, disruptors to emerge. Disruptors is a lovely term that I heard this morning in one of the sessions, and I think that's right. too often, where we are making advances, it's because people are disrupting the system, people are challenging the system. We've got to kind of allow people to do that to a greater extent. We've got to encourage a wee bit more of the risk approach to public services than we have in the past. But silos strike me as a major problem. I was struck by Scott's comments earlier that I fully agree with, and I think is hugely important in terms of how we measure success and how we regulate it, how we audit what we do in the public services. We do it in silos. We do it in silos, and the measurements we often use are frankly inadequate. And someone else had made the point that if we measure it, then that's what we will do. And quite often, in terms of outcomes, it is very difficult to measure outcomes, not least because the outcomes will not always be immediately apparent. It can take time. And again, I think Angela's point about looking to the future, giving us a space to think, to develop policy, even, frankly, to make mistakes, is vitally, vitally important. So we do need to have all of those things in place. I was always struck when I was listening to the conversation on the panel earlier on. I was reminded of my own doctoral supervisor from many years ago. And David Butler was his name, still alive in his 90s. And David always said, he spent his entire career as a quantitative social scientist. In other words, he dealt with numbers. That was his life and his career. And he reflected on this at the end. And he came to the conclusion, he says, sometimes what counts can't be counted. And I think that's hugely important. And coming from someone like David Butler, believe me, that is very significant. So we've got to find ways in which we, if you like, measure success, which is more imaginative, maybe a basket of measurements, as it were. But the measurement shouldn't always be quantitative. Qualitative needs to be in there too. And I think we're very poor at that. I have to say, my community, the academic community, is particularly poor at that. A lot of our research, we're always looking for numbers to put on things, when sometimes it's actually stories. But even that term, stories, it doesn't have the same positive connotation. So we really need to think about how we look at success and how we move forward, taking into account the fact that the world around us is changing, and it is a world in which we're pushing that stone uphill all the time. I mentioned the wicked problems. I really want to stress this. The point about wicked problems, there's too much on this slide, and I'm not going to go into it. Suffice to say, is you can't actually solve a wicked problem. You can respond to it. But you know what? They will always keep coming back. They will always keep coming back. And you've always got to keep responding. And sometimes those responses will differ one time from another. And frankly, also, no single public body or voluntary sector organisation can ever have the only response. There has to be a collective approach to it. Understanding issues and problems from different angles, that kind of multiplicity of disciplines, of angles on any of these wicked problems is essential if we're to move forward. It requires mutual respect. It requires conversations, deliberation. That, I think, is something we're not good at. Why we're not good at it comes back in large measure to the way in which we operate in our silos. I'm an academic, I do it this way. I'm a doctor or a medic, I do it that way, or whatever else. We've got to remember that primarily we are all public servants. Or indeed, better still, we're all members of the public. We're all members of the public. So I think these are some of the key issues that I would want to stress. I do think that silos, actually I think silo working is one of the banes of the 21st century. In fact, probably the 20th century as well. But it is a major problem. I often quote this book by Gillian Tett, one of my favourite, if not my favourite, newspaper columnist, who writes for the FT. Tett wrote a book on the financial crisis of 07-08, and she concluded that a large part of the problem arose from the financial sectors operating in silos. She has an interesting chapter on public services within the book as well, but I think what she grasped was something that we could learn from the private sector as well. We frankly don't encourage people to work outside silos. I often ask people in positions of authority who make appointments, including cabinet secretaries, When was the last time you rewarded, through pay, promotion, someone for work in prevention? I don't think we do enough of that. I don't think we do anywhere near enough. How often do we think, yes, you should get the job because you work collaboratively? How often do we think, yeah, you've ticked that box, you're safe. So we've got to get out of that mindset. I increasingly think it's not just the institutions, the formal institutions that are holding us back. Those silos, it's the silos in our heads. It's the mindsets that really need to change. And we need to encourage that, we need to incentivize that. We need to reward that when people do things. We need to move in that direction which encourages the disruptors, encourages innovation, encourages collaboration. Quite a lot of work has been done in collaboration. God knows there's tons of academic work, most of which isn't worth reading, frankly. And it can usually be summarised fairly well. I think this 2011 report from the Institute for Government in London, superb institution, probably summarises in far clearer terms than like me and other colleagues write what's required. Common purpose is central. Common purpose here. And that takes me back to Christie, because what we talked about there were outcomes. Outcomes. I always remember on the commission, it was Pat Waters who was there. Pat was then president of COSLA, great man, great man. And Pat would often say, you know, forget it. I'm not going to try Pat's accent. He'd say, forget it, it's about outcomes. When I go into my community, is it improving the wee laddie's chances and so on and so forth? He was absolutely right. We need to have that in mind all the time. It's about outcomes, but we need to have that common purpose with the community in mind. A whole system approach. It was really interesting listening to the conversation earlier today, because someone made the point that when you talk about systems, it implies institutions. It implies something kind of mechanical. But we need to move away from that. Maybe whole systems is the wrong language, wrong term. Certainly if that's what it connotes, then it is the wrong language. It's more about an approach, as someone rightly said this morning. It's about an approach, it's about the way we think. That's a crucial part of the whole systems approach. Maybe we should just drop systems and say the whole approach, I don't know, but we do need to get the language right, or more importantly, the thinking right. Shared power. The point about shared power is it's not kind of like 1 + 1 = 2, it's 1 + 1 = 5. We can do so much more together. Again, the point I heard sometime this morning, I can't recall who it was when you look at any place and you look at the amount of public funding going in the different streams, put it all together. Again, my goodness, it's a silo approach in our finances that is a major problem. And of course, when money is tight, what happens? It's my money, get away. That's the attitude we've got to overcome. Sometimes I think we should be bold. We've got to move away from that. Maybe we've got to start saying, right, let's take those budgets and over time, it won't be done tomorrow, it won't be done immediately, but start really sharing it, really sharing those resources. Taking money out of, say, the National Health Service, the most overprotected service there is, and putting it in other services. Local governments faced horrific cuts. Horrific cuts, and yet local government does so much work in terms of public health, prevention. Many of the things that local government does, frankly, we just take for granted. We don't even call it public health, but often that's what it is. So we've got to tackle that issue. Stimulate change. That's the real challenge. How do we stimulate change? That, I think, if we can get that right, then we will really make progress. As I say, I think that in our communities, in our public services, in our third sector, there's a genuine commitment. I am always in awe of folk who are delivering services. I'm in awe of our public services. I think that we need to liberate our public services. And that will involve quite a lot of challenges along the way. And it certainly will involve mistakes along the way. But we've got to be willing to make mistakes if we're seriously hoping to make progress. So, let me conclude, because Mark is making some signals towards me. I'm not sure if they're just root signals of disagreement, but he's signalling something to me. First, I think it's not easy. It's not going to be easy. But the rewards are going to be great if we get this right. And we are getting it right. That's another thing. I maybe should emphasise this. There's been so much good work, so much progress. We know that this can work. That whole point about systems and institutions is important. Institutions tend to become calcified, hard. We need the flexibility. We need the flexibility in the way we approach these things. An approach, whoever it was that said that this morning, I think got it spot on correct. They said approach is not an institutional change. There may have to be institutional change, of course, but that's not to be the driver. Outcomes must always be the driver. So let me just finish finally by saying that I think, you know, a public health record in Scotland historically has been shameful. Shameful. Nothing less than shameful. It is improving, and I think if we can harness the goodwill in our communities, the extraordinary professionalism, the energy in this room and elsewhere, we can move forward. Campbell Christie, I remember asking when we all got together for the first term, I said, so what's your ambition for this? And he said it's just quite simple. I want a better Scotland. That's what we can achieve.